Hi everyone, my name is Ashley Bowers and my topic is on the physiological effects of MDMA. I chose to research MDMA because it is one of the drugs that I knew the least about, and it has become extremely popular among teens and young adults today. All throughout school we have learned about the major drugs that are abused, like cocaine, heroin, and meth. But MDMA didn't emerge as a popular drug of choice until the early 2000s, and even today the long-term effects of the drug are extremely controversial. I think this is why most schools do not include information on MDMA. It's really important that we understand the drug and its effects better because it has become so popular and mainstream, and we do not have enough research explaining the exact risks associated with it. MDMA didn't exist until 1912 when it was developed by a chemist looking to stop unusual bleeding. The psychoactive nature of the drug wasn't discovered until Alexander Shulgin re-examined the drug and realized the euphoric effects of the drug. By the 1980s, recreational use of the drug had exploded in popularity, and many therapists began using it for treatment of their patients. In order to control the epidemic of abuse, the DEA went into overdrive to regulate its use by getting it classified as a Schedule I drug. This minimized MDMA drug use until about the mid-1990s, when the use of the drug re-emerged amongst college students and young adults. MDMA is more commonly known as ecstasy and Molly. MDMA is the main active ingredient in these two forms of the drug. However, they are normally combined with other substances. These can include ketamine, caffeine, meth, heroin, cocaine, and PCP. Ecstasy is normally taken in pill form, and Molly is the crystal or powder form of MDMA. Since ecstasy and Molly are often mixed with other substances, this is what makes the drugs so dangerous, because people do not know exactly what they are taking and the dosages of each. Most people believe that Molly is the pure form of MDMA. However, it is often mixed with other drugs as well, and is just as dangerous. After ingesting MDMA, the effects typically start to be felt within 45 minutes and can last 6 to 8 hours. Some of the positive symptoms people report experiencing is a heightened sense of well-being, euphoria, increased energy, empathy, extroversion, and desiring to be close to others. Some of the negative symptoms people experienced are increased blood pressure, elevated heart rate, dry mouth, jaw clenching, confusion, lack of appetite, teeth grinding, pupil dilation, and an inability to regulate body temperature. Typically, the drug is used for its energizing and euphoric effects as a party drug in clubs and raves. This can be incredibly dangerous because the raves are usually overcrowded and hot. The high temperatures of the overcrowded parties contribute to the likelihood of a heat-related condition such as heat stroke, dehydration, hyperthermia, and stroke. The research on MDMA is limited, and so far it is really controversial on whether it causes permanent brain damage or not. There have been numerous studies that have shown potential damage from the drug. After testing MDMA on primates, it has been shown that at extremely high doses or frequent low doses, that there is an effect of neurotoxicity on the brain. The damaged neurons in the brains of the primates were still apparent 7 years after the initial drug use. MDMA use directly affects serotonin production and reuptake, and it also directly affects serotonergic neuron terminals and axons within the cerebral cortex. It has also been shown that MDMA can have detrimental effects on the hippocampus and related structures, which play a key role in memory functioning and learning. It is also thought that long-term use of MDMA might also contribute to psychiatric disorders. Alternatively, some researchers believe that MDMA use is beneficial for treating patients with post-traumatic stress disorder and can be used in combination to psychotherapy to treat the disorder. Many researchers believe that the harm that arises from MDMA use is a result of mixing with unknown drugs and the environment. They suggest that by eliminating the overcrowded and hot environments and by using pure MDMA in moderate doses, that they can make great progress with PTSD patients and others who have experienced trauma. Although there are many controversial arguments about MDMA and its long-term effects on the human brain, it seems obvious to me that there are many negative physiological effects and risks with its use. The hot and crowded environment is clearly a major contributing factor to the instigation of developing adverse reactions to the drug. The potentially life-changing consequences consist of serious health complications like hyperthermia, stroke, heart attack, or brain damage, and in some cases even death. Even if these serious consequences do not happen, there is still a risk for long-term serotonin depletion and damages to important structures in the brain that can affect memory, learning, and visual processing. It seems clear that this emerging drug of choice needs an extensive amount of awareness and research to truly identify its threat to the health of society.